to welcome you to the September 2024 edition of the Cafe University webinar series. This is the Climate and Health Educational Webinar Series from the NIH Climate and Health Research Coordinating Center, known among us as CAFE. And today we're super fortunate to be joined by one of our partners working internally at NIH, Trisha Castranio at NIEHS, which is the institute that's really at the forefront of funding climate and health research within NIH. And she's going to be talking to us today about the tools at NIEHS, her institute, that support research and communication in climate and health. So we're all very excited to hear about those. Thank you so much, Trisha, for joining us. I will let you take it away and share screen whenever you're ready.
Great. Thanks everyone for joining. I'm super excited to be here. Thank you to Elaine and Rachel for inviting me to do this presentation. If you have any questions or want to post in the chat your comments, please feel free to interrupt me. I'm happy to pause and answer questions as we go if you'd like to do that, or we can have discussion at the end. So let me again, thank you to the cafe for having me, and let me thanks to all of you for joining us. Today, I'm going to talk about a few of the tools that we have at the NIEHS, but I wanted to start by talking about why do we need tools. I was at a meeting this summer and someone mentioned that we needed to stop making tools. It really took me aback. I was very surprised by that comment, but when I thought about what she was saying was that what we need are to go through the tools, sort through the tools, and have the tools before we make more tools. And I totally agree with that idea, but I would put a different spin on it and suggest that we all make resilient tools. So tools, as my slides point out, are support efficiency, creativity, and precision, and honestly, passion as well. They help us accomplish tasks and achieve goals. And I want you to not only use tools, but I want you to make tools too. I think tools, make the world go round. So I suggest that you do your homework and review the tools that are out there. Don't duplicate efforts. Don't create in a vacuum, but be creative. And again, review and evaluate again and again, not just at the start, but as you keep going, as you go on in the process. This is how you make a resilient tool and things that people will come back to over and over and over again. So why are we talking about tools today? Well, one of the reasons we need a lot of tools is because the problem is here and it's global. The IPCC's 6th assessment report recently came out and pointed out that 3.6 billion people already live in susceptible areas to the negative impacts of climate change. And most of those are felt, unfortunately, by disadvantaged communities. So when you think about the healthcare systems, and we really need to be able to adapt and respond as quickly as possible. There's a lot of impacts coming from climate-related weather events, and the strain on healthcare workers and the demand for the climate-ready workforce in a group that's already overwhelmed. You just can't do it enough. And there are a lot of players, a lot of characters that are involved in trying to respond to this issue. Scientists, policymakers, health researchers, medical professionals, community organizers, teachers, they all want to make a difference. And we need tools, I think, to help these people to respond and to communicate about this effort. So let me talk quickly about what we're going to talk about today. These are the 4 tools I'm going to share with you: our Climate Change and Human Health Glossary, the Climate Change and Human Health Literature Portal, Disaster Research Response Resources Portal, and the Climate and Health Outcomes Research Data Systems Portal. So the Climate Change and Human Health Glossary, we'll start with this first. It's actually not our first tool. It's one of our most recent tools, but this tool is a companion tool to our literature portal. And we realize that the need for better, effective communication is something that would help this transdisciplinary problem. So as I stated here, these groups are all involved and working in their field on how to tackle some of these issues related to climate change. And if you take a term for example, like model and ask mathematicians or ask geologists or ask doctors, they all have a different even definition in their scope of what that term means. So we wanted to put something out there directly related to climate change and human health so that we can all get on board, help standardize language, have effective communication, create effective policy, and help support community organizers to communicate with their constituents as well. So we recognize that there wasn't any resource like this out there, and basically decided that we were going to be the ones to do it. So this resource has over 350 terms. It is designed to support the standardized language, establish data harmonization, encourage clear communication on climate change and health, and then help all of these groups work together, as I said, for effective communication. So here's the homepage for the glossary. There are a lot of different features here. I'm going to roll through them. I thought it'd be more effective to do the screenshots, and I apologize that they're not quite a full page on it. We wouldn't be able to view it if we did it that way. But one of the things that we always do with our tools is to be transparent about our process. And so on the left nav, you can see that we have an about page. It talks about why we created this tool, how we did this tool, and what the process is to how to follow up on that. We have a contact us, so that if you want to reach out, if you have a term that you would like to suggest or a definition you think should be revised, you can reach out to us there. And then of course an FAQs question that might have some, we designed some questions that we think might be helpful for if you have a quick review or quick question, may be able to answer your question just by going to that page. So the first thing that you might consider when you come to this page is to throw in a keyword. You wanted to look for something specifically. You can do that. When you enter the keyword here, it will search through the entire database, which includes the terms, the definition, and the context, the climate context. Those terms that may be, so if you were looking for a term related to weather, it may, since the glossary is listed in alpha order, then that term may not be the first thing it comes up, might be confusing. So then you can click the box for the search term only, and that term will then show up right at the top. You can also, again, jump down to do the alpha order and click on that link and go down to your term you're looking for, dengue or something like that. Another option is to search by category. And we have 7 categories for the glossary. We decided to categorize the terms so that if you weren't familiar with any of these sections, then you can go, if you were a community organizer and wanted to help people understand, some of the science behind the earth and atmosphere related to climate change, you can go to that category and see all the terms related to that category and then share that knowledge with your friends. So if we look at exposure, for example, it not only gives you the definition of the category, but it also tells you how many terms are in there. And then you can scroll down and see all of those terms. I just jumped it down to show you all the terms that start, again, alpha order in there. You can look at those individually, or you can expand them all or collapse the definition. Oh, if you just want to look at one specifically, you just hit the plus on the side and it'll roll down and show you. And so, for example, here's the term pathogen. It has the definition according to our group related to, and then the climate context to help you understand a connection to climate change. Perhaps pathogen isn't a term that necessarily you think of in climate terms. And so we added the context for specific terms like that. We connected the terms, as you can see, listed as related terms, other terms within the glossary that are similar to this term, again, that may be able to help you understand the category better, and then, again, the category as well. If you click on any of these, they will take you either to that term or back to that category. And as we switched out to virus, I had clicked on virus to show you, then it'll jump right to that page. You can go back to pathogen, or you can go back to the category and view, start over from where you were again. So a lot of options to at least keep the tool, keep you moving in a forward direction and not have to go back to the homepage and start over and restart. The other option is to share and download your terms by checking the box next to the term. When you do that, yeah, it'll highlight those terms. Then you can click on this new page will show up. You'll get the view selected. You can walk those through this page. You can download it to EndNote. You can download as a PDF, or you can email it to your friends, your grandma, your congressperson, anything like that. Just put in their email address. There's the terms and all the information right below into that email, and then just send it off. So this is actually the 1-year anniversary of the glossary. So we do a biannual review of the site and content. As I said, we just launched it 1 year ago, and in March we did a review. We did some, we had, of course, comments from people from our contact us box, but also other comments from discussions at meetings and presentations. So we review and revise any terms that we think we needed help. We always are listening at meetings and looking for new terminology to add. I think eco-anxiety is one of them that we actually recently added, and that one has a lot more mental health, or a lot more mental health and social sciences type terms that are coming into view and coming more frequently up in the media. So we think it's important to add terms like that. We always reach out to external stakeholders and get their feel for the content, make sure that's acceptable to them, especially for that term. For example, we went with our SAMHSA colleagues to ask what they thought. But it's also review time now for the 1 year. So if you're interested in doing that, you'd like to be an external stakeholder, we'd love to have you. So feel free to email me, and I'm happy to include you in the discussion. The next, as I said, this was built as a companion tool for the Climate Change and Human Health Literature portal. This portal was designed after the inclusion of the health chapter in the National Climate Assessment in 2014. They collected resources and references for people to review to help write the chapter. And when they, after all the work and effort of put that collection together, they decided that it was actually incredibly valuable and decided to build this portal. And then every year we continue to collect and add these resources and update it. So this portal is a bibliographic database of global peer-reviewed research and gray lit on the science of climate impacts on human health. It is a global, right? All journals from across the world, English speaking only, unfortunately, but it is literature across different disciplines. It has 250 keywords that we tag and reference to help filter and help with the resource search. It is searches from PubMed, Web of Science, and Scopus, trying to make sure that it's a comprehensive search. And then all of the resources are directly related to human health and climate change. We have 22,625 publications so far. We've actually added 10,000 in the last 5 years. So I can't even tell you the growth over this time. So if you imagine in 2007, maybe we had, or from 2007 to 2014, when they made that original collection, it was probably 3,000. So really, really great to see so much work going on in this field and trying to tackle these really difficult issues. So let's take a look at the Lit Portal homepage. Again, with our transparency, the criteria document for how we select resources to be into the portal, the contact us page, about page, telling you how and why we created the Lit Portal, some of what I just explained, and then of course the FAQs. We have some example, well, let me go back. The portal video, I knew we did this instructional video in 2020. We did a relaunch of the portal and we created an instructional video. It's about 8 minutes long. A shout out to Ian Thomas for narrating that video for us. It's also on YouTube if you want to go check it out. It's a lot, walks you through the process visually, and you can follow through the guidelines there as well. But I wanted to, I missed the example explorations. Each of these are collections from the portal itself. The most recent one we did was the impacts on non-extreme heat on children's health for National Health Week in late June or end of May, I think it was. And if you click on any of those, it'll show you all the resources that are related to that topics. One way to go through without having to search through all the filters and identify that way. So if you don't have a feel, or if you're not sure how to get started, this is a good way to show you, some of the ways that you can make that happen. But I'll walk you through some of the ideas, some of the ways that you can look at the portal and why the portal is designed this way. You can search with the largest filters that we have, our large capacity filters. These, if we select on some of these that have, if we selected one on non-US and under health impacts, mental health and well-being, then you would see your list would come up on the next page with these search results. You can see that there's over 700 papers on that within the portal. You can sort either by the title, or you can sort by the year of publication. You can also sort by year of publication in the left nav here under the filters. But you can see that mental health and well-being, some of the filters that have an arrow to the right also have expanded filters underneath of those, or other expanded child categories that you can review also. If you want to look for a specific resource type, it's not just journal articles, it's communications, it's government reports, it's other kind of literature that may be of interest to you. This is a free open access portal. It is online and there is a mobile version. I probably forgot to say that before. So I just wanted to bring that up too. So I want to drive you through the next category. It would be the analysis, or this second paper, comparative analysis of large scale flood disasters. If we look at a paper, I want you to see what you'll find. If you click on one specific paper, here's the source and the link out to that paper. The resource description explains what each of the tags are that we have identified this paper to encompass. When the search is done to pull all these papers in, each paper is then read, and then each of these tags, they're filters that become filters through the portal, are tagged within that listing, and that will help you to be able to go back and filter it later. So you can see through this one that extreme weather event, the non-US mental health and well-being, but also adaptation and associated demographic vulnerability, or other ways that we could have gotten to this paper as well. So if you wanted to share any of these papers or save them, then this would be one way to or save this search. You can click here on the individual ones there, or you hit select all, scroll through those, and again, back to the screen with your selected options. You can download to EndNote, download as a PDF, or email them, to your congressperson or your moms. You might be interested too. So one of the important things, again, I mentioned, is about evaluation and review. We are vigilant about maintaining these resources. We do a biannual review of this site and the content. It begins with the search process of pulling these papers and sorting them out through all of those. Every single paper is specific for climate change and human health. The Gov team then will do a review for quality assurance, and then also consider inclusion and exclusion for what we would call borderline paper. Perhaps it's a paper that mentions climate change, but doesn't actually go into the effects of climate change on human health, or they talk about climate change. It's a very climate change heavy paper, but not a lot about health, except that it could affect health, something like that. So we can look at those and decide whether or not they go in. The other option is whether or not a paper has a new topic that we might be interested in. So that may come in as a write-in, and we can then include that into our facet and filter options. And of course, we're always updating the sample explorations. Because we had so many papers, I think we had over 4,000 papers this past year, we decided to do that evaluation and review for our process and our guidance documents. So the criteria document is something that is open and available to you on the website. That page explains what the filters are, what the inclusion, exclusion criteria are. And for example, modeling, I know I mentioned modeling before, but modeling has come up a lot. You can type in a keyword and pull up modeling papers in the portal, but machine learning and AI are not something that we had been specifically tagging, and we hope to tag coming in the future. We got to update that. We can have all the ideas, and then we've got to update the application. And so I don't want to get ahead of myself and have you go look for it. It's not quite there yet, but we will are planning to do that before this October. So I hope that, yeah, so that there are any other topics or ideas that you think that are important that we might be missing in the portal, or concepts that we need to address, please feel free to reach out to us. Again, feedback is really important, and evaluation, again, is really important. So we really do think that it's important for people to share their ideas, and we really take notice of it, and we'll respond. So that's where we're at. So the NIEHS has been involved in response to disasters for more than 30 years. When disasters started to hit more the forefront was perhaps around 2012, maybe Superstorm Sandy, where disasters may have been hitting where people may not have seen them. The Ebola outbreak, Zika, Hurricane Katrina, or some of the larger scale disasters then starting to hit, Katrina, Harvey. I live in North Carolina. We have plenty of hurricanes. I have an unnamed storm hitting us right now, and we have the beaches are flooded. So it doesn't even have to have a name to be a disaster. Wildfires are another option, or another climate-related disaster that we're looking into and are part of our literature portal as well. But for the DR2, they, because of all this impact, or because of this research, there wasn't really a way for people to address how to get in there and get boots on the ground and get things moving, have people excited about collecting data, getting IRB approval for their process. A lot of things have to happen, and then preserve the data, preserve the resources. There's a lot going on, and whether or not they have training is another situation where things needed to be addressed. And so the NIEHS decided to create this resources portal. This portal is now a repository of data collection tools and resources cured by our DR2 program to empower human health research in response to disasters and public health emergencies. So built just like the LIP portal, it also has the questions and collections that you can do. You see the COVID resources are here. There are other types of disasters that you may be able to respond to. But this portal is a little bit different. It isn't just literature, but it's also, well, let me go through and mention that we have our usual transparency with the criteria document of how we collect these resources, the FAQs, and of course the possibility to reach out to us if you would like to do that. The other thing is that if you work in this field and you have a resource that you would like to submit, we would love to have that. Feel free to come to this site, and you can do that here as well. These are ready to go research tools and protocols, and we really want you to not only be able to share your research here, but also to see what other folks are doing as well. So let's walk through the portal real quick. some of the search. There's a lot, as I said, this is different from the literature portal. The resources portal here show a different style, and there are different requirements for doing this kind of research. If you just go through all the resources, there are over 500 resources here for to help you follow through. The filtration can show you each of the different ways that the different kind of resources you're looking for example, or if you want to search by an event type, that's another way you can do it. The exposure agent, and then whether there are common data elements or not is another way to do these searches. So many ways to find all the different types of help and resources that you can use for this type of research. I'm sorry, I have to check my notes to make sure I didn't leave anything off. Okay, so just like, yeah, okay, so this process is very similar to the literature portal. If you want to save any of these, you can click all or click the one, hit the view selected, download as an EndNote, download as a PDF, or email it to yourself or your colleagues. And again, evaluation and review is really important to us. We review this content as well every year for site and for accuracy. We do a lot of outreach for new resources, have workshops, do presentations at conferences and meetings, and really want to, again, engage stakeholders and get people involved so that we can keep this tool up to date and keep people engaged in the process. We also review the criteria document to make sure that we have all aspects of the research that would be helpful for you. So no problem, reviewing or refining any of those activities to keep it fresh and keep it up to date with the research that's constantly growing. The last project I want to talk about is our newest one. It is Climate and Health Outcomes Research Data Systems. It is a PCORDF funded project, which is the Patient-Centered Outcomes Trust Fund. It is through the Office of Assistant Secretary for Preparedness and Evaluation, ASPE, also known as ASPE, out of HHS. This project is aimed to build and strengthen data infrastructure for patient-centered outcome research on climate change and health, and will provide accessible, timely, harmonized, interoperable, and linkable data on environmental factors, exposures, and health outcomes. They will provide analytical and educational resources so that characters can assess health effects, create and evaluate evidence-based interventions to protect communities, and anticipate and respond to potential adverse health outcomes. This project started just a year ago and is a really extensive project to build a platform for data integration. I can't tell you how many people and how much work has gone into this. I have the program page here, and then a recent article from our NIEHS newsletter that talks about some of these efforts. This is the objectives and deliverables from the project: a web-based catalog of available resources, standardized linked data sets, creating a toolkit for resources and educational purposes. If you're new to integrating climate and health data, this will be a one-stop shop for you to learn about that. Some of the issues related to climate and health is that, again, not just the language, but also people working in a field and not necessarily understanding the other field. And so this can help to bridge that gap is what our intent is. We are creating a use case surrounded or associated with wildfires. And then again, the last objective is related to evaluation review, which I'm the team lead for. So, there you have it. This platform has recently launched the landing page and the data catalog. So it's just at its early stages. We have 3 years to complete this process to have the whole platform up and running. But for now, what we have excuse me, is the catalog of resources and data sets. This slide, or this section across the bottom, is the banner across the program, or across that landing page, which I have the link to here. But it also will, as I said, provide training resources and use cases. There'll be ways to help you understand how to evaluate data, how you can drill down into different types of data. The privacy issues associated with health data, we all know, is really difficult in the US. There's also some highlighted research that is showing people that have integrated these two types of data, and how they went about it, what the results are, or what you can do with this type of information if you are just into it new. It also links to our literature portal and glossary to help people, one, find more publications, but also to communicate effectively within this new realm. So the CORDS catalog is brand new. Honestly, I took this picture 2 days ago, and it's probably even higher than 103, but these resources are here to demonstrate the different types of data that are out there, whether it's you can type in air pollution or PM 2.5 or some other kind of exposure data, or if you want to know the data from the specific resource, if you want NASA data or EPA, these are the ways that you can drill down into this resource, pull this data out here, and start to explore what all the different types of data are available for this kind of research. It's massive. I can't even tell you. And I think as a health researcher, I could say that the geophysical data that's out there feels like a fire hose, that there's so much, and this is the great way to drill down and help you at least have curated data so that you can pick through the many resources that are out there. And kudos to all of those organizations. So again, the process includes evaluation and review. We did have to create an evaluation plan and a dissemination plan. They were submitted and approved in February. I also do an annual internal review to make sure that we stay on track and keep up, with budget and hit our deadlines and keep our promises. We are always open to feedback from our constituents. If you have a use case that you're interested in, as I mentioned, we were looking at wildfires. I think perhaps drought and heat would be another relative topic that would be easy to tap onto within that same realm. We are also sharing this, of course, during conferences and meetings. So any kind of feedback that we can get from there, we're also looking for people to share. If you have data sets that you created or that you're working on that you want to be posted onto this site, we're happy to have those. Please feel free to reach out to us. Our evaluation plan and the final development of the platform is due in March of 2026. So I know I started the story talking about tools and whether or not we actually need tools. And I don't know if you've been to a big box warehouse like Lowe's or Home Depot. There are lots of tools there, and there's probably always more tools every time you go. So I always say there can never be enough tools, I'm sure. But I really want to encourage you to create tools, get involved in tools, even if you're just an external stakeholder, help people to make better tools and to keep those tools alive so that they continue to contribute to the research and communication on climate change and health. Right, the glossary for communication, the lit portal for curated resources, the DR2 portal for the quick get the boots on the ground and have disaster research, effective disaster research. And then of course, the CORDS project with the integration of data and for climate and health. So I can't begin to list the people that are associated with this. I actually tried, and it was about down to a size 4 font. So I just decided to list the teams instead. the literature portal and the glossary team, some of that has some overlap. Our disaster research response team, the CORDS team, our NIHS web development team who builds these applications for us. The MDB support team helps to do the searches for the literature portal and help to develop the glossary and collect definitions for those. The DLH Corporation team works on disaster research response team or disaster DR2 portal. And then NTT is the contractor for the NIHS web services. And then of course our external stakeholders for that we just we couldn't share this work without any of their feedback. So we're really grateful for their expertise and support of all of our work. I also want to thank, of course, Rachel, Elaine, Kevin, and Lily Nichols for their help and allowing us to contribute to this process and talk about climate change and health with all of you. So I just want to say thank you. That's all I have. If there are any questions, yeah.
Thank you so much, Trisha. This was an awesome overview of all these tools that I think even I, working in this space and working in the Climate and Health Research Coordinating Center, was not aware of all of these tools. So, so thanks for sharing these with us. I just have a first question, and then I would encourage the participants to either post any questions in the chat, and or you can also raise your hand and we can unmute you if you'd like to actually discuss something with Trisha. So if you want to ask your question verbally, just raise your electronic hand in Zoom and we'll unmute you at the appropriate time. So my question was about the literature portal. So as a researcher in climate and health, I'm often actually looking for the epidemiologic research on, climate exposures and health outcomes. But I also spend a lot of time sort of looking for papers and existing research on ways to measure climate exposures, sort of without papers that often don't explicitly have a health component. It's just about how to like measure these climate exposures better or in new ways. And I'm curious, based on what you were saying, I wasn't sure if that kind of literature that doesn't have an explicit health component, that's more just about measuring exposures that then we might go on to use in a health study later, would those kinds of things generally show up in the literature portal?
I'm going to go with it may. So so a lot of what is done through the search is done in the abstract. A lot of people talk about climate change or health in the abstract and then don't mention the rest of it in the paper. So I'm not sure what specific exposure you're talking about, but that actually would have a health outcome, and that would likely be in the portal as well. So that would show up. I would imagine that would be there.
So there would need to be an explicit mention of health somewhere in the paper in order for it to
I can't imagine
qualify.
talking about an exposure without having, if you're measuring it, are you measuring it relative to an exposure to human beings? I mean, maybe I'm misunderstanding your question.
Yeah, I mean, sometimes we just, we sort of rely on papers that often aren't NIH funded type research, that often come from like NSF or something like that, where researchers are just purely focused on like, the atmospheric chemistry of modeling, like how wildfires start or something like that. So something like that, that's sort of, trying to develop a new way of better measuring wildfires, but that might not ever explicitly say anything about health. It's just sort of creating a new way of measuring exposure or measuring or sort of tracking using satellites where wildfires are, but it doesn't actually explicitly make a connection with health in the paper. Those probably wouldn't show up, it sounds like.
Right, it would not. I would suggest that it would not. If you're just talking about the geophysical aspects of it, and there isn't a health component specifically, right, it's not in this portal. It may be referenced from a paper in this portal, but it's not referenced. Sure. It wouldn't necessarily be in this portal.
Sure. Got it.
Thanks. That's
and then if I understood correctly, the DR2 portal, the main difference in that and the literature portal is that it's more focused on like the practical, folks who are actually going in and intervening in disaster scenarios, the tools that
Right.
they could use, that are oftentimes totally separate, from sort of scientific research.
Right. Well, it also can give you ideas on what kind of survey questions you should ask. It's a great resource to go through if you're looking like for East Palestine recently is the most recent disaster, for example, that may have protocols in there and ideas, and some of them are IRB approved, or it just get you to have that idea in your head if you haven't ever done it before, or you just have an idea you want to confirm. It's a great way to look for those, what kind of, as I said, survey questions to ask, perhaps what kind of data you should be collecting, how to save that data, things like that. Does it have to be on ice? Does it have to be refrigerated? Things like that. All of this kind of information can be found right under that, into
Got
that.
it. So it would really be geared towards people who want to go into a post-disaster scenario and conduct a research study on something about the health impacts of it.
Right, right. How to train the people that you work with to do it, how to do it in an effective way, how to share get policymakers to accept this data, the results of your data. Yeah, there's a lot of information in there regarding how to do that exact research.
That's awesome. Yeah, super useful. Opening it up now to any questions from the audience. Again, feel free to raise your electronic hand, and we can unmute you.
Can you hear me now?
Yes.
Okay. I guess there is a delay somewhere. I wanted to ask about the repository. Does it include something around mitigation and adaptation strategies, or just the scientific component or the data-driven component only? I'm asking because some projects would delve into something like housing characteristics and how we can modify the urban environment. Also, how we can like apply green roofs or all those strategies beyond understanding the dynamics between the climate and health. We want to look at the health impact. I mean, how to moderate or reduce the impact of that using some green infrastructure strategies. So I'm wondering whether this repository would kind of include that. Thank you for sharing it, but I've not had time to look at it myself. So I just wanted to ask that now. Thank you.
Yeah, so if you're speaking about the literature portal, it does have adaptation and resilience components to it, and those interventions are an important part of how to address health outcomes. If you're talking about the DR2 portal, I don't think it has those, but I'm sorry, it's not my area of expertise, so I don't want to say that it's not there. But my understanding is that it's not in the DR2 portal, but it is in the climate change and human health literature portal for sure.
Other questions, folks, feel free to raise your electronic hand or write in the chat. Hearing no more questions. So in that case, thanks everybody for attending, and thank you so much, Trisha, for sharing with us. We will be having another exciting webinar with a group from the Harvard School of Public Health next month on climate and nutrition related issues, studying the impacts of climate on nutrition. So hope to see everyone there in October. Thank you again so much, Trisha, and hope everyone has a good day. Thanks.
Yep. Thanks, everyone.